Bob and the other leaders within our department and our residents have worked very, very hard to create a truly outstanding orthopedic residency program. And Bob will not want to tell you himself, but he actually runs the orthopedic educators course for the country, for all of the orthopedic educators around the country. And so he has some really unique qualifications that have led him to be truly expert at this job, and exhibits a true passion for it and a true passion for our residents. And he's inculcated that among the rest of our faculty as well. And Bob, I'd love you to expand a little bit on some of the things that you're working on with the residents and the program overall.
Well, thanks, Jim. And it's important for applicants to know, one of the first things you think about in the program is you look at the leadership, and I think applicants can feel very comfortable knowing what an outstanding job he's done in his time here, and the leadership he's provided to the department in terms of giving us a direction and really building on some of the core values of the department, but also kind of building on that and taking us some new and exciting directions. One of the first things an applicant should think about is there a good, healthy culture in the department, and is there solid, excellent leadership? And I think you can look at Dr. Sanders and know that you can feel comfortable in that regard.
Our faculty meetings are a lot of time spent discussing changes to the residency program. You've got Bob Esther, who's been the program director here for countless years. I don't want to age him, but it's been a long time. He has a lot of respect and clout within the department, and so when we say this needs to happen for the betterment of education, that's what happens. And everyone's fully behind it, because half the faculty trained here too, and so you have that investment in the program. It's where you came from, you want to also see that succeed.
One of the things that I really liked about UNC was just the heterogeneity of the program. So the fact that all of our residents don't look the same. We have a lot of different faculty from different backgrounds, but also a good portion from UNC that chose to come back, and I thought that also spoke well to the just the program in general.
All of the residents came to UNC with the hope and the goal and the expectation of building surgical skills and a strong foundation in orthopedic principles. We get that dimension with our faculty mentors, and then I think that we evolve a lot over the 5 years, personally, more so than I appreciated before residency. The faculty are really guiding lights in that evolution.
Your residents become a second family. Like Arvin and I have become best friends throughout this whole process, and when you need someone to help you out for whatever reason, there's never been a time through the last 5 years where I needed to either change a call day or needed someone to help me, and there has never been a time where there wasn't one of my fellow residents that didn't step up and say yes.
We are constantly evolving as surgeons. We are not going to look at what we did 10 years ago and be like, that's fine. We're going to be like, well, what's happening? What's making better? How can we do things better? You get to know us better, you get to know our preferences, and you get to know what we think is the right thing to do. And you're going to take from what you learn from us and make your own decision.
It's pretty interesting, because I had the opportunity to work with one of our recent graduates, and so he's came back and he was doing his first night on call, and he had a case he hadn't seen since residency. But it was something that he had seen during residency, and he felt comfortable doing it. That it made me think that that could be me in a couple years, being on call doing this case, that if I was at another program I might not feel comfortable doing those type of cases. But having seen a lot of the graduates over the last few years, that as they're leaving they seem very confident and very competent in the operating room, that makes me feel really good about my education and training here.
They will push you to the edge of what you know and then take it a step further. And they'll find that step. They do a wonderful job of finding that step that you don't know, whether that just be in clinical judgment or operative judgment or your operative skill. And they will take you to that step and then keep leading you there, and then lead you further and further beyond until you really do master it. They're wonderful teachers in that regard.
Seeing the leadership and how they interact with the residents and how dedicated they are with Dr. Esther and now Dr. Sanders, they're people that I respect how they practice medicine, who they are as people, and how they teach. And I think knowing that was going to be the leadership at this program, assured me that it would kind of stem from them down.
You can learn by seeing, but I feel like for me, you learn by doing, and so very good advocates to make sure that especially like us PGY1s, have those opportunities.
It's okay to not know, and I feel like it maximizes my learning when I can ask questions and not be nervous to do that, and that helps me just learn more efficiently and feel like, okay, well, they don't seem concerned that I don't know this, so like it's gonna be okay, I'm gonna get there.
Even day-to-day work, if you have a concern about something, or if you think that something doesn't look right, or you're not comfortable with something in a case that is happening, the attendings here are very, very receptive and approachable, and they want to help you. They really do want to help you learn and become the best surgeon that you can be.
We all kind of come into residency wanting to be surgeons and knowing how to operate, but when we come in as interns, that's probably the scariest thing in the world because we don't know how to do anything. And we progress along, and it's amazing how much we learn every year, to the point where now as chiefs we feel comfortable doing all kinds of different operations. Pretty amazing to think about where we were just 4 years ago, and then now we can make our way from start to finish in a surgery, and that's what we wanted to do. That's what we're most proud of, and what we want to continue to learn how to do as we graduate and move on.
You know, starting out your first day of surgical residency, you don't want to be thrown into something where you're not comfortable. I think here we do a really nice job of surgeons allow you to do an appropriate amount for your skill level, and it builds from there to the point where as a PGY2 you're actively involved in the surgeries that are happening, and you're not just simply observing. So it's active learning, which I think is important.
You come to residency, you work hard, but we want your whole life to be good, not just what you do here. We are not unapproachable. We pride ourselves on being family friendly.
We interact with our trainers, our primary care sports medicine docs, and we're really all a team trying to get an athlete that's been injured back to the way they were before they were injured. So I think it's as simple as that, and there's sometimes that our stakes are higher as they get closer to ACC championships or NCAA tournaments, but we really try to have the best interest in that athlete or patient to try to do what's best for them in the long term. We're all in this together, and I think it's, always more fun to do things as a team as opposed to an individual, and I think that gets passed along to our residents.